Today we're at ESMO and we've been presenting the data from the intracranial activity of the ALTA-1L trial. And this is looking very much in some granularity as to the outcomes of patients in terms of the efficacy of these patients treated with either Brigatinib or Crizotinib from the CNS viewpoint in the ALTA-1L trial. Now, we reported the ALTA-1L trial in Toronto at the World Lung Meeting and also in parallel in the New England Journal, and this demonstrated a superiority for Brigatinib over Crizotinib in patients with ALK-positive disease, and we've been looking at the outcomes of patients with CNS disease. The outcomes really are very much favourable for patients receiving Brigatinib with an overall intracranial progression-free survival hazard ratio of 0.27, demonstrating the marked superiority of Brigatinib over Crizotinib. And what's really interesting is that in those patients that have CNS metastases at baseline, which represents 30% of the trial population, the response rate for Brigatinib was at 79% compared to 28% seen with Crizotinib, demonstrating the superiority of Brigatinib over Crizotinib. We've been looking at the intracranial activity of Brigatinib with Crizotinib, and by performing a competing risk analysis, we've been looking at the time to progression in the CNS without systemic progression, and we see that this is strongly in favour of Brigatinib with a hazard ratio of progression in the CNS of 0.3. But what's really interesting is that if you look at the risk of progression systemically without intracranial progression, this is also in favour of Brigatinib with a hazard ratio of 0.5 compared to Crizotinib, and it's one of the few next generation ALK inhibitors which has demonstrated this activity in terms of systemic progression benefits versus intracranial benefit.